In today's lecture, we will learn when insulin therapy is recommended in type 2 diabetes based on HbA1c percentage. This is a very common question for medical students, and today I'll simplify it for you. Let's look at the clinical situations step by step. Here's the first scenario. A new patient diagnosed with type 2 diabetes comes with an HbA1c of 9.9%, but has no symptoms of hyperglycemia such as polyuria or weight loss, no hypertension, and no other health issues. In this case, we do not start insulin immediately. Instead, we start with oral therapy, usually metformin, plus another oral agent like an SGLT2 inhibitor or a DPP4 inhibitor. Insulin is not needed at this stage, but close monitoring is important. Now, let's move to the second scenario. A new patient also has an HbA1c of 9.9%, but this time the blood pressure is high, 160 over 100 millimeters of mercury, and the patient feels mild fatigue. Here, we need to control both sugar and blood pressure, so we start oral anti-diabetic medicines along with antihypertensive drugs. If there is no improvement in 2 to 3 months, then insulin should be considered. Now, the main question, when should we shift a patient from oral drugs to insulin? There are a few important situations. First, if HbA1c stays above 8.5% even after maximum oral dose. Second, if a patient presents with clear symptoms of hyperglycemia, such as frequent urination, excessive thirst, or unexplained weight loss, insulin therapy should be considered, especially if HbA1c is 9% or higher. Early insulin treatment is recommended to provide rapid improvement in blood sugar control and may help restore beta cell function. Third, if HbA1c is 10% or higher, insulin therapy should be strongly considered from the start. Other situations include patient intolerant to oral drugs, special conditions such as surgery, infection, pregnancy, or severe illness, and if the patient develops kidney problems or new diabetes-related complications. So, how do we initiate insulin therapy? In most cases, we start with a once-daily basal insulin. Metformin is usually continued, we don't stop it right away. It's also very important to educate the patients about the warning signs of low blood sugar. The insulin dose should always be adjusted gradually, and kidney function should be monitored on a regular basis. Thank you for watching the video. If you found this lecture helpful, don't forget to like, share, and subscribe for more clinical tips.